Good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. Thank you for being with us today on this Friday afternoon. I have with me Dr. Sanmi Areola, who is the Director of Johnson County Department of Health and Environment. And thank you to Brett, our ASL interpreter. Dr. Areola, I will just turn it over to you to give your update, and then we'll take some questions if we have them.
Thank you, Jody. Good afternoon, everyone. I'll provide brief updates on our vaccination efforts this week, as well as what to expect next week. And we'll be very happy to answer your questions as much as we can. We are currently in phase 2, tier 1. You would remember that because of the large number of people that qualify for phase 2, we prioritized phase 2 into 3 tiers. We're currently in tier 1. We have clinics ongoing for emergency services. Those are law enforcement. The last clinic that's scheduled for that group is on Monday. There could be a few that remain in that group. We'll just work them into other clinics, but by and large, after Monday, that's one part of phase 2, tier 1 that we expect to be over on Monday. I'm also very happy to report that Children Mercy started vaccinating yesterday, educators and some of our childcare providers. Yesterday, they provided vaccinations to almost 1,500 persons in that group, and they also had clinic today. So that's very encouraging that part of tier 1 is ongoing. And not only have they included vaccination of the special education teachers and School of the Deaf, is that they are expanding that to others in that group that include home providers at our childcare clinic next week. Again, I do want to emphasize that that's also a fairly large group. When you combine the number of childcare providers who have indicated interest in being vaccinated with the number of educators, that we're talking about numbers in excess of 25,000 persons. So again, if you take that in perspective, you know that the 2,000 doses here and there, while it does reduce the number of persons in that group, we still have a long way to go. But that's ongoing. We're very happy with that. I also want to, again, talk about our largest group in this tier, which is our 65 plus. And the good news is we have our health systems vaccinating in this group. I know that they've been reaching out to members of the public and vaccinating in that group. I think Advent Health has a big event that's going on tomorrow with the goal of vaccinating about 2,000 persons there. Of course, all of the appointments have been booked. They are just executing the plan tomorrow, so there's no need to call. The health systems are reaching out to you. I know quite a few of them are having where you can sign up to indicate interest, just like we do. And again, the goal for us is to have multiple providers doing that, and that's what we're doing. Based on the number of doses that we have, which is rather still limited, but we are pushing this as hard as we can, as fast as we can. We are vaccinating. We are using up the doses that we are receiving as we get them, and that's going to continue into next week. So we're very happy that our health systems are chipping away at the 65 plus, and we're doing the same thing in our clinic. So next week. And I should mention that the question about second doses, that continues. Like we've said, we do have your doses. And next week, Tuesday, for those that are due their Moderna vaccines, we have opened up about 1,500 appointments for those that are due between now and Tuesday. Again, things to keep in mind is you don't have to get the second dose at the exact date. You have up until 42 days after the first dose. So as we, if you're due, your second dose is due next week, Thursday, Friday, you just need to wait for our next appointment. But we're taking in on Tuesday about 1,500 appointments for those that are due their Moderna dose. So the question then is, what if I'm due my Pfizer dose between now and next week? So we're also opening up appointments for you on Wednesday and Thursday for those that are due their Pfizer dose. So I'm pretty sure that most of you, whether it's Moderna or Pfizer, will have received those invitations from us earlier today to book those appointments. So again, re-emphasizing that we have your dose and we're scheduling as things go. So hopefully that answers a lot of the questions that people have about the second dose. Now, again, point of emphasis is as we open up appointments, we continue to still have people in the in phase one healthcare worker category that we are working in. We continue to work in as many in 80 plus category as we can. And so multiple things going on in every clinic that you see us open. Not only are we having second doses, we're having healthcare workers still remaining from first dose, and we're working at 80 plus in. I will say that the appointments that we opened up today for next week that are largely intended, or at least originally intended for the older population, we're having, again, asking people to be patient so that when it gets to your turn or to when we get to your age category is when we are asking you to book the appointment. The appointments next week are likely directed towards those who are 80 plus. Happy to take your questions, but as always, we are very happy that you want to take the vaccine. We appreciate the interest. We ask that you keep the interest up. We ask that you try as much as you can to work with us as we walk through this, because even disruptions here and there tend to complicate things for us a little bit. So thank you for your cooperation.
Thank you, Dr. Areola. Now we'll take a couple of questions that we're getting in. I want to ask one question about second dose because you gave some good information there. So if somebody is due for a second Pfizer dose next week, should they have heard from you yet?
So it depends on the date. So
Okay.
so for the clinic that we have on Wednesday, apparently if you are due for the Pfizer dose on Friday, you will not be included in that. So that's for those that are due on Tuesday. That's for those that are due for their second dose up until Tuesday the 9th. And it's Moderna. You will be invited for that. For Pfizer on Wednesday, it will be for those that are due their second dose until that Wednesday, which is February 10th. Okay. If you are Pfizer until Thursday, it will be for those who are due their second dose until Thursday, the 11th. Okay. So it depends on when. So if you are due for your second dose on Friday, you will not have heard from us thus far because our clinics are set up until Thursday, but you will hear from us once we set up the clinic. And that's why we're saying you may not, for example, be able to receive your second dose until the following week, and that's okay. It doesn't have to be the exact day. We were having questions from people who were due their second dose today. They will get their second dose next week. Again, it doesn't have to be exact. You have 42 days until the first, from the day that you get your first dose. So if you're due and you haven't heard from us, that's because your time, it does not fit into the clinic that we have announced thus far.
And I think what I heard you say, just to reiterate that, if your due date for your second dose is February 12th or later, you would not have gotten an email yet.
That is correct. Yes.
Okay. And if it's earlier, if it's the 9th or the 10th or the 11th, and you're hearing this and you think you should have gotten an email, you probably want to check your junk or your spam folders.
Yes.
And then if there's nothing there, is the best advice to call the health department?
The best advice is to call us 913-715-2819 or email us jcdha@jocogov.org. Just reach out to us if you think you should have gotten it and you haven't.
Great. Are the invitations for those second doses coming directly from our health department? For those who did not go through an employer invitation, and this had to do with Pfizer, so I don't know if you know an answer to a question that specific.
Right. Yeah, but when you took your first dose, you booked an appointment with us, and in that appointment, we asked for contact information, whether email or phone number. So we have those, and those are what we use to reach back out to you. And the link to book those may not necessarily reflect JocoGov. I believe it comes sometimes it's set more does something, so it comes in different shapes and in different forms. But typically, we're using the contact information that you've provided to us to reach out to you. But
Okay.
again, if you feel like you are due your second dose and you have not heard from us, reach out to us. But our teams worked very diligently, working with our DTI team, combing those records. Sometimes people book appointments, they don't necessarily show up for the vaccination for different reasons. So we look through our data to ensure that we have the list of everyone that was vaccinated, and then we call you back. Now, be sure that you are attempting to get your second dose from where you got your first dose. So if you got your first dose from somewhere else, we don't have your record. And quite candidly, at this time, we do not have vaccines for you. You should reach out to get your second dose from where you got your first dose from.
Okay, that's some good advice there. And speaking about second doses, and I don't think we've talked about this too much on these calls. So can you talk about some of the side effects specifically of the second dose, maybe compared to the first dose that people might expect when they get that shot?
Right. So excellent question, Jody. I think with the first dose, most of what we've heard from people is apart from the feeling or slight inflammation at the point of injection, you could have a slight fever, mild fever. That's what we've heard from people. The second dose, the impact in terms of fever or shivering tends to be slightly more pronounced than the first dose, and that's to be expected. The way that I explain that to people is your first shot, your first jab is the first introduction of this quote unquote unexpected material in your body, and our bodies are programmed to detect foreign materials and fight them. We have innate immune responses to those things. Try not to get overly technical, but there are chemicals in our bodies that once they sense that, they begin to move towards that point of contact and try to understand what they are seeing and trying to understand how to disarm or to make them less adversarial to our bodies, for lack of a better word. So once you get that first injection, your system looks at certain characteristics, and so next time it comes, it's not completely new anymore. Your system is aware that this is what it is, and so the second time that you have that kind of injection, then all of your immune system, the so-called T cells, B cells, really go into full gear. Now it's not a novel material in your system anymore. It's something that they've seen before, and so when you see all of those fever and shivering, which I had myself when I took my second shot, it's really your body doing precisely what it's meant to do. It's your body's immune system really going into high gear. Moving to the point of entry where those materials are, producing materials to neutralize what we call neutralizing antibodies, just to fight those infections. So when you are seeing that, there's not a better indication that your system is functioning well as it should. That's not a better indication that the vaccine is doing what it's supposed to do, eliciting the expected reaction. That's what's going on. And some people, for me, in my case, lasted a couple of hours. And I stopped shivering, and I haven't felt anything since. But again, that is your body reacting as we would expect it to react, and it's not significantly different than reactions you get from other immunizations, other vaccinations also.
Great, thank you. We have a couple questions having to do with healthcare systems. One person is asking, has KU been vaccinating yet?
Okay, KU has been vaccinating really even before we were allotting part of our vaccines to them. I speaking with Dr. David Wild there last week. At that time, in the 65 plus category, they had vaccinated over 6,000 persons then, and I will say a significant portion of that are Johnson County residents, even before they took our vaccine. So they've been working they've been vaccinating. I think the only thing that's probably limiting their vaccination efforts is supply issue. But yes, they are vaccinating. They are reaching out to people. I was on the call with Dr. Wild earlier this week, and he confirmed that. But they only have so many doses to work with. And so if they have not reached out to you, it just means be slightly more patient. Now we have all of our health systems doing that. Again, I would reiterate that some of them only got a few hundred doses, which is not a whole lot considering the thousands of patients that they have in their system. So again, if you haven't heard from them, just exercise a little bit of patience. There's so many people that want the vaccine and very few vaccine to move around.
Okay. And if somebody, again, we've talked about this before, is not associated with a healthcare system such as Olathe Health or Advent Health, when can they, or what is their best course of action if they're in the 65 plus group?
Right. So several of the health systems, including Advent and I believe including KU Med, actually now have options for people who are not necessarily their patients to signify interest and assume to provide information that they can reach out to them when they have vaccines and appointments. But still the best line of action if you are not affiliated with any of these facilities is to book your appointment with the Department of Health and Environment for now. And again, based on what we heard from the federal government yesterday, there are vaccines that will be going out to pharmacy groups. I think looking at that group in Johnson County, Walmart was listed on that group, and they plan to add additional pharmacies as things progress. But so you'll be able to get your pharmacies through multiple routes in the next few weeks. Again, still the primary limiting factor is supply. As more doses of the vaccines become available, they are going to be pulling in several more providers. And so being a patient of a health system becomes less important to your ability to get the vaccine. Again, we've got a ton of people that want the vaccine, and we only have few vaccines coming into our county. As more vaccines come in, there will be additional providers, and there will be multiple opportunities for you to get your vaccine. Right now, if you are not affiliated with the health system and you can't get vaccine through them, complete our online survey. If you have completed our online vaccine interest survey, just wait for us to reach out to you. And that again is based on how many vaccines we have that determines the number of clinics that we can run.
We did get contacted by one of the healthcare systems today, just asking us to clarify something that they're hearing out there. They want to make sure that the guidance or the recommendation is not for people to go to urgent care centers to get vaccination. I've never heard that that's anything we're recommending or that should be recommended. So can you just confirm that?
Thank you. If people are going to urgent care centers, I can assure you that they don't have vaccines to give. Um, uh, the I cannot overemphasize the fact that there are very, very few vaccines coming into the county. And for the past couple of weeks and up until now, all the vaccines that are coming into the county are coming through the Department of Health and Environment. So we know where the vaccines are going, and we've been making it very public where they're going. Some have gone to these health systems. The rest we have used in our clinics. And so the urgent care clinics don't have that. Now, in the future, with this federal retail pharmacy program, where some are being shipped to pharmacies, it will be additional outlets for the vaccines. Right now, urgent care clinics do not have the vaccines, and calling them or going there will not be productive.
Okay, good. I just wanted to make sure we clarified that. So thank you. We have a question about what happens to the doses once a clinic is over for the day and maybe one or multiple people missed their appointment, didn't show up, so you've got those extra doses. What do you do with those at the end of the day? Is there a standby list or what's the approach with those?
Yeah, so there's so many planning and calculations and assumptions that go into not just creating the number of appointments that we give, but also the number of persons that we serve, as well as running operations of the clinic. And so, no, we don't throw vaccines away. Our goal is to get vaccines into the arms of as many people as we possibly can. But I can tell you, towards the end of the clinic, our clinic managers are watching the flow of the vaccines. They're watching Pfizer, for example, with about 5, sometimes 6 doses per vial. We're calculating, we know how many people are coming every hour. We know how many people are down to the last 30 minutes. So we are not just randomly opening new vials. We're watching who has what and among the vaccinators and what is left. And so I don't want to promote the standby or people, because many times nothing remains. And if you are there waiting for hours, it's not worth the effort. But towards the last half hour to an hour of our clinics, we're watching when we need to open new vials. We're watching the flow. We're looking at least how many remains, and typically get the vaccines into the arms of people. We don't throw vaccines away. We vaccinate people, but we are not keeping standby list. I know places that are keeping standby list, and typically they are down to 1 or 2. Um, in a day, and then they call. But I mean, if we have hours and we have to do that, we have first responders, law enforcement that are available that will call to come and get it. But we have calculated our doses very effectively, and it's not a good idea for people to wait hours in our clinic waiting for that one dose that might remain.
Based on how far we've gotten so far in the 80 plus group and just knowing how many doses we've been getting and how many people are in that population here in Johnson County, do you have kind of a ballpark? This is a question we have on social media of when you expect to be finished with 80 plus with that group of vaccinations?
That is an excellent question, and that's one that we are looking at all of our numbers to uh, be able to more accurately predict. So I would tell you that there are slightly over 20,000 of our residents that are 80 plus, and some of them apparently have been vaccinated through the Federal Pharmacy Partnership Program through CVS and Walgreens, and like the number that I shared yesterday, slightly over 10,000 in that program have received vaccination, but clearly not all of them are 80 plus. Some are a lot younger than that. And so, but tough to estimate because we just don't have that number. So I don't know how much of that 10,000 to subtract from our 20,000.
Mhm.
Last week in our big clinics, we vaccinated over 6,000 persons there. Now, that does include a few second doses. That does include some healthcare workers. So we're working through that data to see what percentage of that is actually 80 plus. And as always, we do have some of those that are taken up by people that are younger than 80 in there. We had those issues last week. And so the plan next week was to use Wednesday and Thursday largely for the 80 plus. I wish I could say that we have a mechanism in place to completely make sure that that happens. Because again, we're still vaccinating healthcare workers and others there. And so I think we're working on getting a clearer picture. But the data that's reported to the state currently is incomplete because of the lag in reporting. We also know that our efforts to address the independent living environment, where we have about 24 facilities that were not covered by the Federal Pharmacy Partnership. And based on our call and estimate, we think slightly over 1,600 persons needs to be vaccinated. Again, a lot of them will be 80 plus, but I can't tell you what percentage that would be. So tough to estimate. Our calculation earlier today was our focus on that population. Our focus to be mainly on that population for the next couple of weeks. And after that, we feel like we would have done, we expect to have gone through most of that. But then there are some factors outside of our control that's making that very difficult to predict. So that's a long way of answering the question that the picture is not very clear. We're working to make it clear.
Well, great. Thank you very much. And I just wanted to end this on a note, just sort of kind of recapping some of the progress that we made this week in terms of communication and processes. So people that are taking the interest surveys now will get an email confirming that. I know that was really important to people. In addition to seeing the confirmation on screen, there's a comfort level of getting that email saying, we've got you, you're in our system. So that was something that we added this week. I know we have added resources to people that are answering calls and emails and social media posts. So hopefully the public is seeing the results of that. Dr. Areola, anything to add to that?
No, I think that's a great way. Some of we've always thought that we want to communicate and keep you up to date as much as possible. And some of the efforts that Jody mentioned, so some of those ways. I just want to add, especially since we are still unable to match the level of interest with the number of vaccinations because we don't have the vaccines, that it continues to be very important to wear your mask, physically distance, and get tested. We have really large testing capacity in the county, and still public health techniques of case investigations and contact tracing are still very crucial to our efforts to contain the spread of this virus. At best, right now, we're probably anywhere from 6 to 7% in a percentage of our population vaccinated. So we're a long way to go. So we cannot put our entire efforts on vaccination. We cannot put all of our attention strictly on vaccination. We need to continue to do the other stuff.
Great. Well, that was great information, Dr. Areola. Thanks so much for taking the time every day this week to get this information out. Thanks so much to people who are watching on Facebook and asking questions. Continue to ask them. We will continue to answer them. And I hope that everyone has a great weekend. So thanks so much.
Thank you, Jody.